When anybody does any type of genetic testing, it's not going to be perfect. We all have different genetic variations. Now, does that mean that we all should do genetic testing? It could give some information as far as medications, if someone maybe can't handle a certain medication due to a specific genetic variation. And from a functional medicine standpoint, sometimes it could be valuable. It's not going to change. It's not like doing a saliva test or a stool test, where if you do a saliva test now and then do another one even a month or two from now, you could get changes. But your genes are your genes. So once you do whatever genetic test you choose to do, you got the information, and that information will be good for many years. You won't have to worry about not doing those. And that's something to keep in mind. My answer to the question, should all thyroid patients do genetic testing? I would say, hey, this is Dr. Eric, and in this Q&A episode, I am going to answer the question, should all thyroid patients do genetic testing? So let me start off by mentioning that prior to my Graves' disease diagnosis, I did not do any genetic testing. Now, to be fair, that was quite a while ago. That was 2008 when I was diagnosed with Graves' disease, and the tests, most of the tests that are available today for genetic testing weren't available back then. A number of years later, I did decide to do the 23andMe test, which might have been available in 2008. I'm not sure. But again, I did it years after I was in remission. And the reason I decided to do the 23andMe test is because, again, years after I was in remission, I did homocysteine, and homocysteine was elevated. And when it's elevated, it could mean that there's problems with methylations. And I think that's what really motivated me to do the 23andMe test. And sure enough, it did reveal homozygous MTHFR C677T genetic polymorphism. It revealed other things too. And that's going to be with anybody. When anybody does any type of genetic testing, it's not going to be perfect. We all have different genetic variations. Now, some like the MTHFR genetic variation, and again, there's a few different ones. You could also get the heterozygous C677T or there's the 1298. Again, the point is, we're all going to have genetic variations. Now, does that mean, again, that we all should do genetic testing? Even though this Q&A episode is focusing on those with thyroid conditions, we could really ask this question for everyone. And so I will say that I do not require all my patients to do genetic testing. And a big reason is because for all these years, I've had great success without having patients do genetic testing. That being said, it is something to consider. It's definitely getting, we'll see in the future where more and more practitioners are doing genetic testing, not just functional medicine practitioners, but perhaps even conventional medical doctors, because again, it could give some information as far as medications, if someone maybe can't handle a certain medication due to a specific genetic variation. And from a functional medicine standpoint, sometimes it could be valuable not only with the MTHFR, that's more well-known genetic polymorphisms, but there are other genetic variations one can have related to detoxification. I also should have mentioned at the beginning, a genetic polymorphism is the term, or single nucleotide polymorphism. That's fancy term for a common genetic variation. So we all have common genetic variations, and some of us, though, have a certain variations related to detoxification. So we might not do as good of a job detoxifying compared to others. And vitamin D, we might have one or more genetic variations related to vitamin D. So we might have a higher requirement for vitamin D. Now, again, a lot of times we could figure this out if someone is taking vitamin D and their vitamin D levels aren't increasing for what, or maybe they're increasing, but not like we think they should. So that could be a sign that they have a genetic variation, but it would be nice to know. And that is an argument for having everybody do some type of genetic testing. Again, not just specifically the vitamin D example I just gave here, but other variations could sometimes give us some information, some helpful information. And this is especially true for some complex cases. So again, I don't know if everybody really needs genetic testing. We can say that maybe people do because in the future, maybe it will be required. And so why not just get it now when it's not going to change? It's not like doing a saliva test or a stool test, where if you do a saliva test now and then do another one even a month or two from now, you could get changes. But your genes are your genes. So once you do whatever genetic test you choose to do, you got the information, and that information will be good for many years. Now, some companies are better than others, so you need to keep that in mind. So you might choose a company that's not as comprehensive as another one. And here's also an example, like there are companies, and I admittedly have sometimes had patients go through these other companies like Life Extension, for example. You could just look at the MTHFR. There's a test that looks at MTHFR and COMT. And those are only two genes that this test looks at, and it's less expensive than doing a comprehensive panel. But you could, again, make the argument, well, if you do the comprehensive panel, it should include those two, and then you won't have to worry about not just doing those, but others as well. And that's something to keep in mind. I mean, there are other companies like Genova Diagnostics I use for some testing, not genetic testing, but other tests. But they have, I believe, genetic panels that just focus on certain areas, like a genetic panel for just detoxification, and they might have a few others. I mean, there are also methylation genetic tests, so that just focus on methylation. But it might make sense just to spend the money and just look at everything, even though it'll cost more, but we're not looking at usually thousands of dollars more. We might be looking at a few $100s more. So that's something also to consider. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. So recently I was on another podcast and they were asking me about whether I test, like there's what's called HLA markers to determine if someone is more susceptible to Graves or Hashimoto's. And they asked if I do such genetic testing. And I said I don't. And the reason for that is because, I mean, first of all, most people will come to me, they're already diagnosed with Graves or Hashimoto's, or if they have a non-autoimmune thyroid condition, typically they're diagnosed with that as well. So if someone has toxic multinodular goiter, usually that when they see me, they're already diagnosed. So that's one reason. And even if I were the one that was doing the diagnosing, again, I'm not sure if I would recommend the HLA markers because it's not really going to change much. I mean, maybe in the case if we're not sure if someone has Graves, if the antibodies are negative, but they're having other signs like thyroid eye disease, and I mean, in that case, maybe there's that argument. But similar with celiac disease, if you have positive HLA markers, it doesn't mean you're going to develop celiac disease. It just means that you're genetically susceptible. And same thing with the HLA markers for Graves and Hashimoto's. So yeah, that's just my perspective. And I wanted to bring that up here because there might be practitioners who do that test. And I don't think they're covered by insurance. They might be, but it's just another expense for the patient. And that's also the way I look at genetic testing too. When trying to prioritize the test, at least as of now, to me, genetic testing hasn't been a priority. Maybe it will be in the future. And if someone absolutely wants to do genetic testing, that's fine. I mean, maybe even one of my patients or multiple patients will listen to this and say, you know what, I think I'd like to do some genetic testing. And that's fine. I have no problems ordering a genetic test, or obviously they could get it on their own. But that at least is my answer to the question, should all thyroid patients do genetic testing? As of now, I would say no, just because I've had a lot of success and other practitioners have had a lot of success who don't do genetic testing. But there is a time and place for genetic testing. And perhaps in the future, everyone will be doing genetic testing. I mean, without question, more and more practitioners are already doing genetic testing on a frequent basis or on a regular basis with all their patients. And maybe 5 years, 10 years from now, we'll get to the point where pretty much all functional medicine practitioners and more conventional medical doctors will be doing genetic testing. So as usual, I hope you found this Q&A episode to be valuable, and I look forward to catching you in the next episode.